Good afternoon and welcome to Frequently Asked Fridays. I am Andrea Bonina and I'm a partner here at Bonina and Bonina PC. As the attorney in charge of all nursing home cases here at the law firm, I get a lot of questions from people who are concerned family members and want to know how they can make sure that their loved ones are safe in a nursing home or long-term care facility. So, for today's FAQ Friday, I wanted to answer the question, what are the warning signs of nursing home neglect? So, the first thing I want to acknowledge is that the prospect of putting a parent or a loved one into a nursing home is one of the most stressful and difficult decisions anyone can make. So, before we talk about warning signs of neglect, I wanted to talk about how you could choose a good facility where hopefully you're not going to have to worry about whether the person you love is being neglected. Um, Everyone wants what's best for their loved ones, and there are times when you're caring for someone who's elderly, and usually because of dementia or some other illness that affects memory or safety, there are times that a family member has to consider a long term care facility or a nursing home for a loved one. And when choosing the facility, there are things that you can do to make sure that your loved one's rights are going to be protected and respected and that they're going to get the best care possible. Um, a good resource, and what I always recommend to people, is Medicare. Medicare has is responsible for doing safety ratings on nursing homes, and their website, medicare.gov, is a tremendously good resource. If you go there, you can check on the facility's safety record, and how you navigate to that is you go to medicare.gov. In the upper right hand corner, there's a space where you can click to providers and services. Once you do that, you can get to a page where you can choose the option Find Care Providers. Um, and that will take you to a place where you can search for nursing homes. And they allow you to search by location. So you could put in your zip code or the county you live in, and it'll give you a list of every nursing care facility in that area. When you get that list, there's a star rating, and there are ratings. You can have a one-star facility, a five-star facility, but they give you not just that overall rating, but what they base it on. And they'll give you on that site the details of the health inspection findings, the staffing inspection findings, as well as what Medicare found when they looked into the quality measures at each individual nursing home. So you can dig around through the nursing home ratings and see how many deficiencies were found on inspection. And those deficiencies cover categories like freedom from abuse, freedom from neglect, freedom from exploitation, um, what the infection control deficiencies are that were found, and so many other areas that Medicare looks into. So it is a fantastic resource and a really good starting point if you are looking into facilities and considering this very difficult decision for someone that you care about. I would also recommend going on a tour of whatever facility you're considering, and you want to look and see how the people look there. Do they look clean? Do they look well cared for? Is the facility itself clean? And one question you definitely want to ask is, what is the nurse to patient ratio? More patients that any nurse has to take care of, the harder it's going to be for that nurse to give each one of them adequate care. So choosing a place with a low nurse to patient ratio is important, or patient to nurse ratio, I should say. So if there's one nurse for every five patients in one facility and one nurse for every 10 patients in the other, obviously the one where there is a 1 to 5 ratio is going to have a nursing staff that has more time to devote to each patient. So that's an important question. Now, in New York and on the federal level, there are laws to protect nursing home residents. Unfortunately, despite these laws, elderly people are still neglected and even abused in nursing homes. And In my 30 years of practice, I have seen some really, really sad cases where this very vulnerable population is just, really had terrible things happen to them in nursing homes. Under the current laws, nursing homes are responsible for injuries that are suffered because of a failure to prevent pressure sores, also known as bed sores or decubitus ulcers. They're also responsible for a failure to provide adequate nutrition, adequate hydration, and a failure to maintain a resident's ability to bathe, dress, groom themselves, and walk from a bed to a chair. So, you know, one thing that I see a lot on my nursing home cases is where there have been terrible bed sores. If your loved one develops a bed sore in a nursing home, or becomes extremely malnourished or dehydrated, that nursing home may have gone beyond just neglecting them. They may actually have broken the law. So that is a big red flag. If there is a bed sore, a big red flag for neglect. Bed sores, basically, if you're not aware of this already, they are injuries to the skin that occur because of sustained long periods of pressure to areas where there are bony prominences. So they're frequently seen like on the tailbone, on the heels, on people's hips or elbows, areas where bones may stick out. Um, and they occur normally because patients are not being moved enough or aren't being given tools to offload pressure from those areas of the body. Now, unrelieved pressure on areas with bony prominences will squeeze shut the capillaries that deliver blood to the skin and the underlying tissue. And without fresh blood bringing in oxygen and flushing out waste, the tissue and the skin can become damaged and it can start to die. And that's what causes these sores to become painful open wounds. There are a lot of ways that nursing homes can keep bed sores from developing, but most important are keeping a patient clean, hydrated, well nourished, and turning and positioning them at least once every 2 hours. That's essential. Non healing sores and sores that are not adequately or promptly addressed can cause very serious problems. They can lead to sepsis, amputations, osteomyelitis, and even death. So it's a serious problem. And if you see a bed sore, you want to make sure that that's being taken care of right away. Okay. You want to make sure that there's a wound care doctor that's seeing your loved one, and you may want to consider changing to a different nursing home. Poor hygiene is another red flag. If you find that your loved one is in a very wet or soiled diaper, that can be a huge indication of a problem. Um, and it's also something that can lead to the formation of a bed sore, which can develop into a very serious health emergency. Bruises or contusions, unexplained injuries, frequent falls, significant weight loss, those are all serious warning signs that there's a big problem. As is over medication and sedation. If your loved one is being given a lot of sedating medication, and sometimes sedating medication is necessary because someone gets agitated as a result of Alzheimer's or dementia. But you want to make sure that they're not being given so much sedation that it impedes their ability to move on their own, because that can cause bed sores to develop and other health problems to develop. So, if you see any of these signs, you need to speak to the care providers at the nursing home, and you may need to consider transferring to another facility. Being involved, seeing your loved one regularly, being attentive, that's going to be key in making sure that your loved one gets the proper care. So, have your eyes and ears open for any of these signs, and make sure that the people you love are protected. It's very hard to make that decision if you have to decide to put a loved one in a long term care facility. So, if you do, you have my sympathy and my empathy, because I know that that is a very tough thing to do. And I hope that the information that I provided you with today helps you make the best possible choice for the person that you love and that they are safe and well cared for. Um, Thank you for joining me this week for Frequently Asked Fridays, and please join me for another episode next week. Actually, it's not going to be me, it's going to be Erin Peak, and she's going to be discussing documenting your sexual assault case, what is evidence, and how can you preserve it. So, thank you very much, and join us next week.